This year, Mental Health Awareness Week is observed between the 15th and 21st of May, the focus for which is about increasing people's awareness and understanding of anxiety. And in this video, I'm going to break down the 5 most common types of disorder. Be sure to watch until the end, as I'll also be sharing 3 practical tips on how to cope better with feelings of anxiety that can help prevent it from becoming a problem. Anxiety is a natural response to a dangerous situation and is a function of the sympathetic nervous system. Symptoms of anxiety can vary in severity, but include sweating, dry mouth, increased heart rate, stomach cramps, alongside intrusive or persistent thoughts. There are many factors in everyday life that can lead to feelings of anxiety, including exam pressures, relationships, starting a new job, or other significant life events. We can also get anxious when it comes to things that relate to money, like heating our home or buying food. Anxiety disorders are more severe than normal levels of anxiety, and if unrecognized or untreated, can interfere with a person's work, relationships, or social life. There are many types of anxiety disorder, but for the purpose of this video, we're going to focus on the following 5. Obsessive compulsive disorder, also known as OCD, is comprised of obsessive thoughts and compulsive behaviors and affects around 1 in every 50 people at some point in their lifetime. Obsessions are unwanted and unpleasant thoughts or images which come into your mind repeatedly. They can feel like a stuck record, and trying to resist them can make it worse. Compulsions are repetitive thoughts or actions you feel you must do, often until they feel right. The aim of a compulsion is to try and relieve the anxiety or distress caused by obsessive thoughts. Generalized anxiety disorder is a long-term condition that causes a person to feel overwhelming anxiety or worry about a wide range of everyday situations rather than one specific event. Symptoms can include restlessness, fatigue, muscle tension, and sleep disturbance. It can also cause significant stress or impairment in social or occupational areas of a person's life. Risk factors for generalized anxiety include gender, family history, childhood adversity, alongside exposure to sexual or emotional trauma. Post-traumatic stress disorder, or PTSD, is a condition that some people develop after experiencing or witnessing a life-threatening event or serious injury. Traumatic events can make it feel that our lives are unpredictable, and as a result makes it difficult for us to feel safe, trust other people, ourselves, and our own judgments. The defining characteristic of a traumatic event is its capacity to provoke fear or helplessness in response to the threat of injury or death, and therefore can affect anyone. Examples of this include, but are not limited to, assault, childbirth, natural disasters, and acts of terrorism. Symptoms of PTSD can include hypervigilance, negative changes in beliefs or feelings, avoidance of situations that are reminders of the event, or reliving the traumatic event in the form of flashbacks, nightmares, and intrusive memories. Phobias are a specific fear which cause avoidance of activities. Many of us have fears about particular situations or objects, which is perfectly normal. A fear becomes a phobia if it is out of proportion to the real or perceived danger, lasts more than 6 months, and has a significant impact on the way you live your day-to-day life. A person may not experience any symptoms until they come into contact with the source of the phobia. However, in some cases, thinking about the source of the phobia can make a person feel anxious. This is known as anticipatory anxiety. Panic disorder is when a person frequently experiences either the fear of or actual panic attack. It can happen suddenly, feel intense, and bring about an overwhelming sense of dread, fear, or the feeling that you might be dying or having a heart attack. The person may also experience other physical symptoms such as chest pain, sweating, dizziness, and shortness of breath. Most panic attacks peak and subside in about 10 minutes. If you find yourself in this situation, be assured that the feeling will pass. Breathe slowly, and if possible, try to focus on one or several non-threatening things in your immediate environment. This could be the time passing on a clock or something that you can see, hear, and touch. We've just covered the 5 most common types of disorder. Now I'm going to share 3 simple yet effective habits you can use on a daily basis to help cope with feelings of anxiety. Taking the time to keep a record of what's going on in your life and how it's affecting you can help you understand your experience, which in turn can help you better prepare for and manage situations or scenarios that may cause anxiety. Set aside time in the mornings to sit with your worries and write them down. You can then move on with the rest of your day, reassured that you've taken steps to take control and stop anxiety getting in the way of what you want to do. We know that spending time in nature has a positive impact on our mental health, as it helps us feel calmer and less stressed. Whether that's tending to some flowers in a garden or going for a walk in the woods. To really get the benefit, try to spend a significant amount of time either in or with nature on a daily or weekly basis. We spend a significant portion of our lives staring at a screen, whether this is to communicate with friends or attend work meetings. In particular, excessive exposure to news or social media can have an adverse impact on a person's sense of self-worth. In part, this is due to us attaching our feeling of safety to people or events that are outside of our control, which can exacerbate exacerbate feelings of anxiety. Challenge yourself to do a digital detox by limiting screen time before you go to bed. A decrease in screen time is linked to improved melatonin secretion, which is essential for helping us switch off and get a good night's sleep. To continue learning proven strategies that reduce feelings of anxiety and heal trauma, click or tap the screen just here to watch our full review of Finding Inner Safety, which is the latest book from physiologist and sleep expert Dr. Nerina Ramlakhan.